everyone. Welcome to the DigiTech Health Leadership Talks webcast. This is a series of interviews promoted by the group working on digital and technology driven transformations from the Young Executive Leader Program by the International Hospital Federation. Thank you for showing your interest. For this interview, we have invited Dr. Harish Pillai, CEO, Aster India, Aster DM Healthcare. A doctor with exceptional leadership skills, Dr. Harish Pillai joined the Aster DM Healthcare Group as the CEO of Aster MedCity, Kochi in the year 2013. His ability to strategize and manage large-scale healthcare organizations helped Aster MedCity consolidate its place among the top hospitals in the country in a span of just 1 year. One of the most influential leaders in the Indian healthcare industry, Dr. Harish Pillai is a member of Joint Commission International Standard Advisory Panel and member of Governance Council of Association of Healthcare Providers. Having spent the past 2 decades in hospital operations, and his work profile includes hospital and healthcare, business feasibility studies, commissioning of greenfield projects, strategic restructuring, turnaround hospital projects, and academic work spread across several countries. Hello, Dr. Harish Pillai. It's warm welcome and my pleasure to having you over here.
Thank you, Dr. Sudha, and thank you for having me in this program. Delight.
So, Dr. Harish Pillai, how do you see as a CEO transforming digital health?
Honestly speaking, in the earlier days in traditional healthcare organization, the due credit for any kind of transformations of this sort would go to the Chief Information Officer, the CIO. But because of COVID, we have to give all credit to COVID-19. The pandemic has acted as a big catalyst in changing paradigms and to ensure that all of us adopt digital in a very big way, in a manner that we can continue to provide services to the communities in which we exist and also extend care to areas and geographies where previously we did not have access to. So digital is the way to go ahead.
So my next question, how can mHealth along with telehealth contribute to better patient outcome from the perspective of value-based healthcare?
So if you look at a demographic slice of diseases and patients, there is a growing burden of disease in the elderly population, and many parts of the world you're finding that slice of the demography is a growing segment. And if you look at the 50 plus category, in most countries around the world are at greater risk of chronic diseases, whether it's to do with type 2 diabetes, hypertension. So in these kind of scenarios, instead of frequenting your care providers within a physical brick and mortar setup, now there is an opportunity to access omni-channels. Technologies have developed in such a manner where you can have, in the comfort of your own home, you could have teleconsultations, you can have wearables where your physiological parameters can be centrally monitored by your care providers. And also the algorithms are available, whether it's to do with e-diagnostics or e-pharmacy, where the required chemistry analysis and even the drug prescribed can be delivered at home. So mHealth and telehealth have merged together and it's here to stay. And post-pandemic, I think this will be the new paradigm, what we call as the click and brick model of healthcare, which is sustainable in the long term.
Do you feel that society is embracing mHealth and telehealth, and what are our fears and difficulties in that?
So there are challenges on both ends, from the provider end and also from the consumer end. If I touch out on the provider end, it's a fact that in many parts of the world, due to lack of capital, people have not really been able to invest in the right IT systems, whether it's to do with your hospital information system or electronic medical records. And even if you just patch on to a telemedicine suite, you're not able to have continuity of care due to the disconnect with your electronic medical record. Even if it's an episodic encounter in a teleconsult platform, It's so essential to capture the history, the general examination and systemic finding into your electronic medical record. And if a drug prescription is made, it needs to be archived so that in the second encounter or future encounters, you can make meaningful decisions on the differential diagnosis and also in the care plan. So this is a fundamental practical challenges which many providers are facing, in addition to depending on where you're located in the world, to do with connectivity issues, bandwidth, to have the right hardware platform. So this is also there. The third challenge, which is also emerging mostly in developing countries, is the lack of availability of doctors or even nurses, for that matter, nurse practitioners. In the omni-channel world, let's say post-pandemic, the doctor's office time, if he's a physician, for example, will be consumed in the allocated appointments for patients who are physically coming to see him or her in a hospital setup. Now, to also squeeze in a teleconsult slot within an office setup is rather difficult. And if you force the doctor to stretch his work life into the confines of his home, I'm afraid that will create other pressures in terms of work-life balances. So these are the three big challenges which I'm seeing from the provider base. From the consumer base, especially in terms of elderly populations, even though we find that adaptation to technology has been quite impressive thanks to the reach and power of social media. Sometimes when it comes to teleconsult and follow-up of care, there is a challenge in terms of the ease of use and the simplicity of use of technology options at the consumer end. There are also barriers in terms of the payment gateways. There are in many parts of the world, especially in the developing world, it's still an out-of-pocket kind of experience, but the reach of fintech is trying to bridge that kind of gap. So with the availability of fintech, people are able to use e-wallets and payment gateways to make these transactions meaningful. One last frontier which I foresee also happening is the growing band of insurance and third-party administrator products, or HMOs, which if it can be integrated into this kind of ecosystem, it will make the life of the consumer much more better. Third and the last macro bottleneck is regulatory changes. Sometimes the changes what we see in technology has not kept pace with regulations in various countries around the world. So I hope regulators will also sit up and take notice and create a framework which is flexible and adaptive and also future proof.
What is the impact of COVID-19 on mHealth and telehealth? What do you think that the pandemic has done for the technologies?
So the tech sector needs to. I suppose in a perverse manner, it is the. I suppose this is the only sector which would say that the pandemic has been a blessing in disguise, and it's a fact that if COVID-19 had not struck us, many of the early adapters to the tech platforms would have been laggards, and they would not have probably come on board. So the pandemic has accelerated the early adoption of technology in a very big way across landscapes, and I think that has been quite phenomenal. The key to long-term sustainability is to look at the change in consumer behavior. To give you an example, and to share a sense of perspective, when you had extensive lockdowns due to the pandemic, people who were confined to their homes had no choice but to use, let's say, for example, food apps, home delivery apps, whether it is Swiggy's of the world or Zomato's of the world in the Indian context. I'm sure that there are similar food calling apps around the world to have your food delivered in the comfort of your home. To give you another example is Uber and Ola, for example. Again, another example about cab usage. Of course, this was anyway there pre-pandemic. If you look at from the e-commerce world, Amazon, the big uptake in terms of Amazon, and it's something reflective that if you look at the Nasdaq index in the United States, it's only the tech firms with their tentacles in the e-commerce space which has really zoomed and done so well during the period of the pandemic. So if you look at that kind of experience, that the changing behavior of consumers, if it has been solidified that even after the pandemic is exhausted, if such behavior continues that people will consume e-health in a big way, then I think there will be a big shift in the way healthcare is envisaged in today's world. But I'm still saying that's a big if. We have to wait and see what happens.
So, what action should healthcare stakeholders take in order to realize the potential of telehealth?
That's a very important question, because clearly, if you are a provider, whether you are an individual practitioner sitting in primary care, or if you are part of a large enterprise, healthcare provider enterprise, this is a strategic decision in terms of commitments, in terms of time, money, and also efforts. So you need to ensure that you have the right partner who can map out the various possibilities out there, look closely and on case studies, successes as well as failures from around the world in leveraging technology and ensuring a positive impact in the life of the healthcare consumer. You need to absorb these kind of lessons and make sure that adequate budgets are provided, because it doesn't come in a very thrifty manner. Even if you use technologies which are available on plug and play format in using cloud computing, you have a certain OPEX cost which you have to bear across the life cycle, which is spread across many years. Or if you choose to use on a CapEx mode, it's a substantial amount of money which you need to invest. But then I'm quite sure that the way we are seeing trends in other sectors, investment in technology will always pay right dividends if you have spend a lot of time in planning right. Then things should be fine.
So, what action, in terms of being a leader, do you think that is it impacting the normal business when it comes to telehealth being given more importance?
It's a trick question, to Sudha, but let me try my best to answer that. So sometimes when, especially in the context of a pandemic, we are all trying to focus on effective cost management without compromising our ability to render care in a qualitative superior manner. In this kind of a context, one big element of cost is your human resources management. So clearly, when you are embarking on such a big strategic initiative, you would be foolhardy to imagine that without adequate a manning plan which is supported by budgets, you can really embark on an ambitious plan. So I think as a leader, you have to be flexible and adaptive to the enormity of the task, and have the magnanimity to put budgets and to ensure that your teams are not stretched beyond a breaking point. So I think my message to leaders out there is that it's a time for introspection and to be reflective, at the same time to be nimble on your foot, and ensure that your teams are totally supported. In a way, for many of us, living in a virtual world, literally speaking, using Zoom or MS Teams or other modes to communicate with team leaders have been very liberating, in the sense that why I say that is that now it's got its pros and cons, because sometimes we as leaders, we need to be more mindful, like I mentioned before, about work-life balance, and not to be intrusive and step the red line, so to speak. But at the same time, it actually enables us to go beyond the geographies of logistics, to reach out to our team members and ensure that we are there to support them in the front lines. So that way, I think the technology bridges which came as a result of the pandemic has really reinforced leadership in the right manner.
So you need not, the message was very clear that you need not only to think of financial aspects, but then of course that emotional aspect also we need to be taken care when it comes to deal with people, right?
Healthcare is all to do with people, and we are a service sector element. If you don't get your priorities right, then you will have nothing.
What do you think about the national M-Health and telehealth strategy of your country?
So where India is concerned, we have been quite fortunate that in 2020, on the Independence Day of India, August 15, the Prime Minister of India, Sri Narendra Modi, had announced the launch of the National Digital Health Mission, which is basically a landmark, a regulatory framework to foster a complete ecosystem in terms of healthcare. There are some key principles of the National Digital Health Mission. One is to ensure data privacy, where the medical records, the key ownership of the medical records sit solely with the individual. So that rights have been clearly enumerated in this act. The second aspect is in terms of data portability, that when you go from one provider to the other, be it a doctor or a hospital, the data can be kept in a cloud and your file can be accessible to your providers. The third aspect is to create a national repository. For example, there is an attempt to make a national repository of accredited doctors or accredited hospitals. And we are also creating a sandbox to have interoperable systems, which means that there can be one large national database of all hospital systems across the subcontinent. So I think it's quite a landmark legislation. The true effects of this legislation may be seen in the next 5 to 10 years. We have reasons to be highly optimistic because, as you can see, the quick pace in which the telemedicine guidelines were launched in March 2020 has really boosted the telemedicine. I would even use the word revolution in terms of benefiting consumers in a major way in India. India has been sort of a laboratory for change and innovation. Even in the medtech space or in the healthcare startup space, we have more than 3,000 entities out there who are bringing out pioneering products which will not only be beneficial for India, but for the larger world. Ultimately, the consumer is going to benefit. So we are quite happy and fortunate that the due legislative framework has already been established and laid, which will prove beneficial to all stakeholders.
So when you were talking about the unified medical record system, so it is both for private and public sector, or it's only for private sector?
Yeah, as you know, in terms of the guideline, it is meant for all consumers, whether you are accessing private or public health, for sure. And you're also trying to bring in the payers in the ecosystem. Like this refers back to the launch of the PMJ, or the Prime Minister's Jan Arogya Yojana, or it's called the Ayushman Bharat, which is the world's largest public health insurance scheme covering 500 million citizens in India. So this at the point of care is free, and there is a certain biometric card through which the amount is reimbursed to both the patient as well as the provider whenever such a patient accesses either a public hospital or a private hospital. So there is a plan by the Government of India to enlarge the coverage beyond this 500 million number which I spoke about, and also bring in more private players into the marketplace. So the ecosystem will be completely inclusive, and the basic fundamental philosophy is to bring in the principle of equity at the point of care. So no one should be denied access to quality care due to his socioeconomic status.
Next question is, how should the new generation of healthcare managers lead the M-Health and telehealth revolution?
So you need to go back to the fundamentals of and educate yourself more. It's a rapidly evolving field. It'll be good to constantly be in certain e-communities, so to speak, read your journals, see what's happening in your respective countries, learn from across the borders, from around the world. It's so much is happening. You need to get your priorities right and understand what makes the greatest impact for your community, whichever part of the world you may reside in. You can't afford to be a dinosaur. And we all know what happened to the analogy of the dinosaurs. You become extinct. So the key to success and survivability is to adapt fast, be nimble on your feet, learn, and follow Darwin's philosophy of evolution. Be up with the times, and then you will survive and succeed.
So how do you see mHealth and telehealth technologies in 2050? So let's say example, we'll be only speaking about ubiquitous health or we'll be discussing something else?
2050 is if I can carefully predict what will happen tomorrow, I think I will be a wise man. 2050 is many tomorrows away. But I do say that it's a bit frightening, the pace of development of technology and artificial intelligence. I think one thing which our generation will look with a sense of optimism and also brooding is the power of AI and artificial intelligence and machine learning. I think many diseases, the way we see today, will definitely be conquered because we will discover the power of existing drugs. Maybe we can tweak some of the molecules to be much more effective. Cancer, as we see today, I think it'll be a stuff of history because I think the challenges of 2050 will be more to do with clean, potable drinking water and also climate change from a macro health point of view. But yes, what COVID-19 has taught us is that there are many more viruses and bugs lurking in the corners. Is the world will the world be a more safer place in management of pandemics and epidemics? I think the answer will be yes, because clearly the lessons of COVID-19 is that we need to really invest in early warning systems, and the multilateral agencies like the WHO need to really get their act together to put in and invest in early warning systems, which is already there where weather systems are concerned. We have the ability to forecast turbulent weather anywhere in the world. So I think that will be something which will definitely be there. The current demand supply gap, what we see in resource mobilization, especially which to do with the population to doctor ratios or doctor to population ratios, it is quite poorly staffed in many parts of the world. I think technology will enable to bridge that. You may not require as a patient to see to actually physically see a doctor or a nurse practitioner, because you might have AI apps and chats and drones in a big way, which will give you care in the comfort of your home. I think acute care management will see a lot of technology interventions with robotics coming up in a big way, which is AI enabled. I think that itself will be a major change. I mentioned already about drugs and the molecules which are available, vaccines. The acceleration of vaccine development will be at a much greater pace. We've already seen the break of a world record, historical world record of vaccine development in COVID-19. So I think these are those emerging things. And of course, since the human genome has already been unlocked, the power of personalized medicine, where it's not one size fit all, but it's a tailor-made medicine just meant for you as a unique individual. I think that will be more or less a routine affair. It's already there. Immunotherapy is already in vogue for treatment of cancers, for example. I think that will also happen. In the next few years, we will also find an effective cure for Alzheimer's, which is a dreaded problem in many parts of the world. So like I said, the whole disease paradigm will be different. The curative options for many of these facets will also be different. So mankind overall in 2050 will be in a far better place, and hopefully we don't be reckless and destroy ourselves in the process. That's my only prayer, because man's greatest enemy is man itself.
So thank you so much for your time, Dr. Harish, and sharing with us your knowledge, experience. I mean, it's a great pleasure to have you here. And thank you for taking time for us. Thank you so much. Thank you.
Thank you for having me, Dr. Sudha, and thank you so much. Good day.